Good afternoon, everyone. Y buenas tardes. Thank you for tuning in to join the Juanita C Grant Foundation and the National Council on Aging. My name is Vivian Nava-Schellinger, and I'm the Director of Community Partnerships and lead an innovative team supporting our National Institute of Senior Centers, a membership organization designed to provide support and resources for our nation's 11,000 plus senior centers. Today, we'll dive into a conversation that you yourself may be having with friends, with colleagues, with family members. Some of you have likely had this conversation around your kitchen table. We'll learn from national experts on how we can work on the national level to learn from local leaders on what it takes to build trust, acknowledge the complexities in the anticipation of a COVID-19 vaccine, and the skepticism built on generations of distrust in marginalized communities. You know, among older adults, Black, Latinx, and Indigenous communities have seen death rates approximately 3 to 5 times higher than white older adults during the COVID-19 pandemic. That puts them not only at a critically heightened risk of contracting the virus, but at a higher risk of dying from it every single day. Today, we hope to leave you with some takeaways to ensure that the conversation begins at the local level, and we work to build trust from the core out, and that national leaders know that no one can be left behind in the conversation around COVID-19 vaccine. I want to introduce you to today's panel and give them a few minutes to talk about their work and what they hope to bring to today's conversation. First, we have Orleen Grant. She's the president and CEO of the Juanita C Grant Foundation, based in the DC, Maryland area. Next, we have our in-house pharmacist, Kathleen Cameron, Senior Director, Center for Healthy Aging, great colleague of mine as well. And we have Dr. Sandra Quinn, Professor and Chair, School of Public Health, the University of Maryland, College Park. We'll start first with Orleen. Orleen, thank you so much for the work that you've done in your community and frankly to put this event together. Please introduce yourself, and we'd like to learn a little bit more about the work of the Juanita C Grant Foundation. Orleen?
Thank you, Vivian. And first of all, I wanted to say thank you to the National Council on Aging for our continuing partnership, and especially for working with us and supporting us in this effort to bring this town hall meeting to you today. So this has been a great event for us to have this come to fruition. And also, I'm extremely happy to be in the panel with Dr. Sandra Quinn and Kathleen Cameron as my co-panelists. The Juanita C Grant Foundation, the core of what we do is community engagement. One of the things that we did in the very beginning is really to look at what we wanted to do and how we wanted to approach the communities that we wanted to have an impact, and to look at a lot of the issues that one needs to do if you're going to have best practices about community engagement. So really, it started with research. It started with getting to know the nuances of the community, transportation system, healthcare delivery, economic conditions, and who are the influencers within that community. And the foundation's mission really is to improve the lives of the 50 plus through economic stability, research, and education. And through that mission statement, we have been able to identify community leaders, develop relationships with residents, conduct focus groups, and really engage the community in approaching the economic instability factor within the 50 plus range. So some of our programs such as workforce development, annual event that we have with individuals bringing employers to the 50 plus for direct interviews with employers, education on elder abuse and financial fraud, and also working on advocacy issues such as healthy environments, age-friendly communities. We have taken our learnings from being in the community, developing relationships one by one with religious leaders, agency heads, political leaders, and also identified advocates that have helped us open doors to work and build credibility with residents. And from there, we have been able to launch national programs such as our Village Connector Experience, which has gone nationwide to address and interrupt social isolation among older adults. But in building trust within communities of color, it's really having an educated background as to who that community is. Each community is like an individual. They're unique to themselves, and one has to get to know them and to build trust on a one-to-one basis. And looking at the twin pandemics of COVID and historical mistrust of the public health system and lack of access to care, those two pandemics are really just bringing an extremely bright light to longstanding inequities in communities of color, just marginalized communities on housing insecurity, health, lack of disparities in health access, and also just the entire process of having adequate resources to move that community forward. So in looking at building trust, it's really a building block from within, and it's a lot of listening and listening and listening, and then incorporating the feedback and the buy-in from the community in developing programs and then moving out from there.
Yeah, thank you so much. And I know that we're very honored to partner with you really on a number of different issues, one of them being economic security as well and stability for communities. So thank you so much, Arlene, and thank you for everything that you do. We'll go ahead and move to Ms. Kathy Cameron with the Center for Healthy Aging at NCOA.
Great. Well, thank you so much, Vivian. And I want to thank all of you for joining us this afternoon for this discussion. I'm really pleased to be part of the conversation today. And I thought I'd just give a little bit of background on the National Council on Aging. And since 1950, NCOA's passion and mission has been to improve the lives of all older adults. And we accomplish our work in a number of ways. One is through innovative programs, both online programs and in-community programs that empower individuals to make small steps that can significantly improve their lives. So programs like our benefits checkup, My Medicare Matters. I work on evidence-based health promotion programs that are available all across the country. And we work through partnerships like this one with the Juanita C Grant Foundation. And we support a national network of local partners such as senior centers, area agencies on aging, faith-based organizations, and others that touch the lives of older adults. And we work with them to provide personalized services to help individuals stay healthy and economically secure as they age. NCOA also works in a bipartisan manner to protect and improve federal programs that older adults depend upon: Medicaid, Medicare, and the Older Americans Act that supports community-based programs, particularly social determinants of health programs that communities of color really need right now and well into the future. So at NCOA, we truly believe everyone deserves to age well. And to this end, we focus on programs and services that lead to healthy aging of the mind, the body, and spirit for the growing number of older adults across our country. And we know that older adults are becoming much more diverse too. I direct NCOA Center for Healthy Aging, and our goal is to help older adults not only increase the number of years of healthy life, but also the quality of those years, so that those years have true meaning and purpose for them. And that meaning and purpose needs to be defined by the individual. And again, we work with local organizations to implement and sustain evidence-based health promotion and disease prevention programs for chronic disease management, which we know is so important right now. We work on programs related to mental health and substance use disorders, falls prevention, physical activity, all the things that really help older adults maintain their health. And we work hard to make sure that these programs reach communities of color, because these individuals in those communities can really benefit from the programs that we know make a difference. So the work at the NCOA Center for Healthy Aging also includes education related to vaccine preventable diseases such as flu and pneumonia, and now COVID-19. And as a pharmacist, this is a topic that's near and dear to my heart. And I'm going to be sharing a little bit more about the role of pharmacists in a few minutes. Pharmacists are a trusted healthcare professional in communities across the country, and they're going to play a really significant role as the vaccines roll out across the country. So thank you.
Of course. Thank you so much, Kathy. You know, I know as in working with you, I know that your devotion to all of the work that you do, but also more specifically to the social determinants of health and those factors that really determine how we age, where we live, where we work, where we play, where we eat. And so, you know, I would be remiss if I didn't mention that I am actually wearing a t-shirt today that has a lot to do with social determinants of health from our partners at San Ysidro Health and FQHC in San Diego County. They have a campaign going on that shows that research tells us that voting and civic participation in our community has a direct link to our health outcomes. And just to tell us a little bit more about research and, you know, why those factors are important, I actually want to pivot to Dr. Quinn. Dr. Quinn, we've spoken before about really your work at the height of the AIDS, HIV epidemic, at the height of the crisis in the 80s and 90s. And a lot of the work that you've done in the past has been about pulling those most at the outer edges of conversations, pulling them into the center and making them, you know, the focus of these issues moving forward. So I just want to welcome you today and give you the floor.
Thank you, Vivian. You know, recently I was, as all of us are, I'm at home, so I was going through old photographs, and I found photographs from the late 80s and early 90s that were of marches of African-American men who have sex with men, protest marches here in Washington that I participated in. So my public health career has really began in many ways with drug abuse and then HIV. And so early on doing community engaged research about how do we engage African-American communities in the 80s, late 80s and early 90s in HIV prevention. And that really led to the recognition of what, you know, Orlene talked about, and that we know is an ongoing challenge today, is hearing from community members their fears about the Tuskegee syphilis study and being, you know, abused in research, you know, by the public health service and medical researchers. And that study, I mean, over time led me to then, you know, further work around the anthrax crisis when the postal workers also were concerned about, you know, being guinea pigs. They're being perceived as being guinea pigs, and raised the issue of Tuskegee again. And through studies on during the H1N1 pandemic and on vaccine disparities, particularly with African-American adults and flu vaccines, and also today on misinformation about vaccines. So I've done a lot of that work with particularly African-American communities. I'm the Senior Associate Director of the Maryland Center for Health Equity, which really works and engages with both communities in this metropolitan area of Washington, but also with policymakers. So we've been part of a Health in All Policies initiative as well. I've also worked on the development, which is really critical, I think, right now for where we are on COVID vaccine trials. I and Stephen Thomas led a Building Trust Between Minorities and Researchers grant that really was based on the premise that we don't have communities of color participating in research. But what had been happening up till that time was sort of well, why don't these communities participate? And we said, let's kind of flip this a bit and let's listen to those communities, but also let's find out, what are researchers doing, what are researchers not doing, because it's a partnership. And so that led us to really developing a tool called buildingtrustumd.org, which is an online interactive program made exactly for communities to understand what is research and why participate in research, and acknowledges that research abuses of the past and current and bias today in healthcare are still an issue. But there are ways to participate, and that we, researchers and communities, can work together to make that happen. Could not be more vital right now with regard to the COVID vaccine trials. And I know we're going to talk about that in a minute.
Absolutely. Thank you so much, Dr. Quinn. You mentioned that education, of course, awareness is a driver, but education is key. And as we educate our older adults that we serve, and also as we educate one another. So very, very important key factors to think about in this work. So I want to move on to our discussion questions. The first question is for Arlene. Arlene, you did talk about how you are a local community-based organization, and you have been able to really have a national approach on the work that you do. Why is this kind of balance between local and national key to building trust? And I think more specifically, if we talk about trust, how is trust built specifically in the Black community? What are some key things that those that are not within that community need to know and need to start talking about? What kind of conversations should we start having?
Thank you, Vivian. The balance between having a national perspective and also working at the local level has been invaluable for us as far as building credibility, for building consistency in our approach, and also for allowing us to tailor a national product to a local level. As I said before, each community is different and unique unto itself, and one size does not fit all. It's probably one of the biggest lessons we learned in starting working within the community, is really to learn about the community and then work from within to build the product with the community so that it's a community-based solution. So when we've been able to launch our national Technical Assistance and Resource Center, we looked and had information that was not only national resources, but also local resources. So we had a balance of both, so that it just wasn't a very high level point of view or perspective, but it was also on the ground, working with community health centers, parks and recreation, library, working with senior community service employment programs at that local level, and getting to know what was going on in that particular area has been very important for us. I think it's been a very helpful sign and a hopeful sign that for presidents of historical Black colleges and universities have come together to really increase and encourage more communities of color, specifically African Americans, to participate in the trials, the vaccine trials that are undergoing right now. And I think if you quote the quote that came from Dr. Valerie Rice of Morehouse College School of Medicine, in really stating that what's happened in the past has been horrific, but that is in the past. And what the communities now need to know and think and talk about is what's happening now, and how do we as a community gain control over what's going on. And I think that's a very pivotal statement from Dr. Rice, in that Morehouse is in the driver's seat for some of the the funding and the bringing together of the Black community to move forward with looking at COVID-19 vaccine and also underlying issues of health. So you have the compounding factor of wanting to recruit more individuals of color for the vaccine, but also acknowledging the impact of hypertension, heart disease, and obesity, diabetes on this particular twin pandemic. And so you have facts from the COVID tracker, which is a combination between Boston University and the COVID tracking project, that 2.4% of Blacks who contract COVID are going to be have a higher mortality rate. So you have over 21% proportion of Blacks really experiencing a high death rate as a result of these inequities and these underlying factors. So in moving into the community, you need to identify your trusted messengers and who those would be, such as your ministers, bishops of large districts that have thousands of souls under their care, leaders in the community such as university leaders, especially community colleges, or if you're fortunate to have a HBCU in your particular area, that is certainly a megaphone. Looking at your politicians who lead Black communities, county executives, governors, mayors, city council leaders, and also advocates. We have found it's very important to have advocates who are on the ground, neighbor to neighbor, working with the different community groups who are door openers. These are individuals who, with their backing and support, open doors for you. And without these individuals, it's very difficult to walk into a community center and be introduced without a sense of who are you, how long are you going to be there, what impact are you trying to make, and will you disappear in 2 or 3 years? So the credibility, consistency, longevity, and having a trusted group of individuals open the doors for you and work with you and start listening in the community.
Absolutely. Thank you so much. Some of those takeaways, creating space and having the actual community leaders themselves be the ones to create that space and to invite you in. Those are very, very important aspects of community organizing, community building, of education and awareness. Orlean, you yourself in the work you do with your organization continue to teach me that, as we continue our partnership and we work together. So those identifying trusted messengers, all of those things are extremely important, and I thank you for that. I want to pivot just a little bit to this question. Next question is actually for Dr. Quinn. I want to talk a little bit more specifically at some of the real difficulties behind why building trust in communities of color, especially among older adults, older diverse adults who have really this shared history of racial inequality and have seen systems that may necessarily were never intended to work for them, and oftentimes have not. And so, I was reading the news earlier this week, I think just a couple days ago. There was a Moderna vaccine trial, and the headline was that contractors failed to actually enroll enough people of color. And so, I want to talk a little bit about that. And based on your expertise, Dr. Quinn, how important are and how can we address those inconsistencies of the participation either in vaccine trials or in these gaps that are happening, and understanding that developing a vaccine that's not used in a fraction of the population is oftentimes like having no vaccine at all. And so how do we deal with those complexities, and what are some real steps for leaders to be able to have those conversations?
These are great questions, and Orlean has laid the foundation already, so thank you for that, Orlean. So number one, I think, There, as I said before, the participation in research is a two-way partnership. And, so for researchers, it needs to be about developing those community relationships, working with your partners, being invited in, but also it's also about, being ready when somebody says to you, why would I be a guinea pig? I remember Tuskegee or Henrietta Lacks, why would I be a guinea pig? And so, as a researcher, the last thing you can do is be a deer in the headlights. Instead, it's really about, tell me more about that. And what is it about that that concerns you now? And I can understand that. And I also know that, bias is still alive in our healthcare system today. But I also know from my own research that among African Americans across the nation, when they believed they were being treated fairly in a healthcare system, when they were reporting that they were not being discriminated against, guess what? They trusted the flu vaccine more. That makes perfect sense to me, right? So I think a couple of things. So for communities of color, and particularly for older adults right now, one of the things we heard in a lot of our interviews and focus groups with African Americans is that grandmothers and mothers, right? Pivotal. They're pivotal in how we learn to take care of our health through our lives. And what we also heard in some of our national research is that it wasn't that always that just that African Americans or Latinx or indigenous people didn't want to participate in research. Sometimes they were not even being asked. And that's where Dr. Rice, at Morehouse and historically Black colleges and others are really important. So, and what we found was it's not just that they said we'd be willing to consider if we were asked, but that the value of making a difference for their communities, for their children, for their grandchildren, that altruism, that it's about something bigger than me, is really something that many of you live your lives like that. And so participating in these trials is important. So I'm going to give you an example from the past. So all of the research early on heart attacks was done with white men. Then women started having heart attacks, going to the hospital, and physicians didn't know how to treat them. They didn't recognize it because it was different. Now, genetically speaking, we're 99.9 something % the same. But our genes also interact with our environments, with levels of poverty and those social determinants that Kathleen mentioned. And those things all are part of contributing to the disparities in diabetes and cancer and heart disease. So participating in research is vital, both so that, we feel confident that older adults, particularly the older old, need to be representative. So we're confident that the dosages are safe and effective. But for communities of color, it's important. It's also important so that we can then safely, working with those community partners, as Orlene described, help people get ready for taking the vaccine and why it's important to take the vaccine when we have it.
Absolutely. And Dr. Quinn, I was jotting down some notes. Again, I just learned something new every time that we do talk. And, it's not just about cultural competency. It's about cultural responsiveness is what I'm hearing you say. It's in the chat, somebody talked about, is this a framework to also bring in community health workers? And I know that in the Latinx community, right, community health workers are promotoras, and also in the indigenous communities, promotoras, or the community health worker relationship that is on the ground in border communities and on Indian reservations. It's across the country in a way where it is done in such a culturally responsive way that it really connects who we are and the spaces we navigate with the opportunities or the feeling like you said, the feeling like we're being treated fairly in a health setting, which makes all the difference. That could be a difference between surviving and not. So absolutely, and I appreciate you bringing that up. And so we'll actually kind of bringing it down to the community level and thinking about, again, how do we balance this national messaging and also learn from our communities at the same time to create the messages that work. And so I'll go ahead and ask Kathy this, thinking about pharmacists and the importance of pharmacists. Many of us, whether it's the flu vaccine, which I actually just received last week, or it is now the COVID anticipation for a COVID-19 vaccine, our pharmacists in our local community will become such a pivotal and key community member to us. That relationship is so key. But how can other health, mental health, public health, national initiatives like the work that you do at the Center for Healthy Aging, Kathy, how can that take into consideration that it is experts like Dr. Fauci and scientists and health providers and professionals that we need to make sure we're making the space to have conversations, but also that we are building trust in our communities to trust these individuals. So what role does a pharmacist play?
Yeah, thank you, Vivian, for asking about pharmacists. And I guess I'll start there, because there are many trusted individuals in communities and we need to really leverage them. But, certainly pharmacists are a great source of up-to-date, reliable information about lots of things, including vaccines. Pharmacists play a really significant role in educating their patients about many aspects of their health. Not just prescription and over-the-counter medications. And pharmacists are embedded in communities across the country, are conveniently located, they're in safe locations. And many of the pharmacists in these pharmacies across the country look like the individuals living in those communities. So I think people feel comfortable talking with the pharmacists. They build relationship over time with their pharmacists. Pharmacists are one of the most respected and trusted health professionals based on national polls, and they rank high in terms of honesty and ethical standards. So, pharmacists have already been very, very busy kind of preparing for vaccine distribution. They're figuring out how they're going to be dealing with the multi-dose vials that the vaccines are going to be coming in, tracking vaccine doses, because some of the vaccines that will come to the market first will require not just one dose, but 2 doses spaced out, I think over about a month period of time. There are going to be some refrigeration requirements. And pharmacists are already answering lots of questions that people have about the vaccines that are coming forward. Questions from older adults, from their caregivers, from other family members. Some of the questions that pharmacists are hearing about is, do I need the flu vaccine this year? I'm staying at home a lot. I'm wearing a mask when I do go out. I don't think I'm getting exposed, but you know what? The flu vaccine is more important than ever this year. And older adults, people of color can get their vaccines from the flu vaccine from their pharmacists. Also the pneumonia vaccine. It's really important to be up to date on the pneumonia vaccine. And people do ask, well, if I get that, does that protect me against COVID? No, they're very, very different, but it's going to protect them from getting secondary infections if they do contract coronavirus. So I did want to mention that earlier this year, the U.S. Department of Health and Human Services authorized pharmacists to order and administer the FDA-approved COVID vaccines when they do become available. So I think that's really good news, where people, again, are going to have a convenient, safe place to get the COVID vaccine. In addition, I think when we think about communities, another really important player in communities are the local health departments. And the local health departments have been extremely busy over the last 9 months, preparing communities, educating communities. They've been involved in organizing testing sites. They're involved in the contact tracing, and they're getting ready for vaccine distribution. So this is a really important partner for communities of color to work with. And health departments need to reach out to organizations that are trusted in communities of color to provide the information that those communities need as the vaccine rolls out. So, just want to mention that, as well as a trusted resource. And it's really important for older adults, their family members, to rely on their trusted healthcare professionals in addition to pharmacists for information about the vaccines and to have a conversation about the vaccines. So many people have questions about the vaccines. There's a lot of information, I think, over the internet, in the news, and it's so confusing for people to understand all of it. So making sure that people stay as informed as possible, starting now. And we have good sources of information, the CDC, the Immunization Action Coalition has some great information. At NCOA, we are going to be providing up-to-date, accurate, reliable information about vaccines, as well as other issues related to the pandemic. We have been since the beginning, but we're going to continue to do so. I'm anticipating, and Vivian, you may have already been contacted by folks, that I think over the next few months, there are going to be coalitions that will be formed at the national level that will include federal agencies, other national organizations, and they have to include organizations that represent individuals from communities of color. So I'm looking forward to being part of those efforts in order to better educate the public about the pandemic, about the vaccines, and what they need to know as they make decisions about the vaccines with their healthcare providers.
Absolutely. Thank you so much for mentioning that, Kathy, especially as you said, the coalitions that will be built and are being built
Yes.
now. Also, the fact that communities of color, when it comes to health inequity, essentially have been organizing and coalescing for a very long time. And I do think that, you bring up some really good points about systems and really thinking about what systems have been set up in this country to address these issues. And so for the remainder of the conversation, I want to open this question to an answer from each panelist. As we talk a little bit about really kind of I think Orleen mentioned it at the top of the hour, addressing the twin pandemic. Really the twin pandemic that has hit us, and that is the twin pandemic of racial injustice and COVID-19. How do we acknowledge that they exist, and how do we work to repair community trust? I mentioned when we were briefing before the conversation that I was listening to a podcast episode where the Reverend Michael Curry was talking about resiliency and fear and love. And, I thought it was very fitting for this conversation, especially thinking about systems, our systems that have been built oftentimes not for the people that are most vulnerable, older adults and older adults of color. And Reverend Michael Curry said, when the pain of staying the same is greater than the pain of change, then the systems we live in will burst open and be available to everyone. And that really hit me in thinking about the repair that we must do through education and through real honest conversation. And so I want to actually open up this question to Dr. Quinn. How do we instill hope among these communities that I know are going through, and we know are going through, what I'm kind of calling resiliency fatigue? It's a constant kind of hit in the gut. And what can we do as we educate people around the vaccine? What can we do to build trust, and how can we handle these twin pandemics?
Well, you know, that's the big question, right? But what I would say is this: number one, you can't tease these apart. You know, early in the pandemic, I was doing an interview with a journalist, and they said, sort of, what do you think about the disparities we're seeing in COVID? And I said, well, they were totally expected from who works in jobs that are on the front line versus who gets to stay home and work from home, who has health insurance, who lives in neighborhoods with no grocery store that sells fresh food and has diabetes. So all of these things they're like this, they're tied together. And so to think otherwise, you know, is you know, you just can't separate them. But that said, you know, we're not going to solve racism and structural barriers overnight either. So the question is, how do we do it? Because I think number one, you know, I like your comments, Vivian, from Reverend Curry. You know, resilience, it's hard to stay upbeat and resilient when every day it feels like it's just, and COVID was just one more struggle. You know, the murder of George Floyd was one more time, and Breonna Taylor, one more time, just another time. And what's happening in tribal nations, and, you know, so I think number one is that importance of also what we see happening on the local level of communities reaching out and in innovative and new ways looking out for one another. And that's really important. I long for leadership throughout the country from every level to be able to speak with compassion and empathy and to tell us the truth. The truth is, this is going to take a long time, and it's hard, and it's scary, and it's uncertain. But the more we can say, and we feel that pain because we see it, I think being empathetic and compassionate and honest help people, you know, in coping with it. And then going back to Orleans' very first openings is, you know, from the health departments to the fairly qualified health centers to the county executive to faith communities of all type, it's going to take a partnership to both sort of lift people up and to prepare us. If we had a vaccine tomorrow, and we won't, we will still have to social distance. We will still have to wear masks. And we will still, hopefully, at some point, be able to have the economic and social service supports that enable people to stay home and feed their families, even when they're grappling with this pandemic. So I am hopeful that we have been here before, but it's a new day, and it's going to take new partnerships and renewed and sustained energy to build that trust and move forward.
Thank you, Dr. Quinn. And Kathy, as a pharmacist, what makes you hopeful and really, you know, what is kind of the role of, when you think of healthy aging, what is the role of the programs that you oversee in addressing the twin pandemic?
Yeah, that's a great question. You know, I think one of the things that gives me hope right now is what I've been seeing, I think, over the last year and a half. And that is around healthcare and social services integration. When I talk about social services, I mean the broad array of social services that address the social determinants of health. We are seeing much more interest among healthcare providers in understanding that these social determinants of health really make a significant difference in health outcomes for the people who they serve. And they're starting now to want to support those social determinants of health. We definitely need more sustainable funding streams to support those social determinants of health programs, whether it's, you know, housing, transportation, education, employment opportunities. And to me, I think one of the new social determinants of health that we need to think about is access to the internet and technology. That hasn't traditionally been considered a social determinant of health, but it has to be when you think about how healthcare is now being delivered to people across the country, whether they're in rural communities or they're in inner cities. They need to have access in order to, be able to see their doctor through telemedicine. In the programs that I work with, which have traditionally been delivered in community settings in person, they are pivoting now to virtual delivery, remote delivery. We need to get those programs to people who need them, who can benefit from better chronic disease management or falls prevention, whatever it is. But many of them don't have the technology. And also technology is so critical right now to address social isolation that so many older adults, communities of color are dealing with. And we know that social isolation and loneliness leads to poor health outcomes. So I know over the last few months, we've seen really creative strategies to bring technology into the hands of older adults, communities of color, really great partnerships. And when we think about, developing partnerships to address systemic racism, we have to think very creatively. Business needs to be involved, technology companies, we need to get philanthropy involved at the local level to support some of these new initiatives to address so many of these problems. Yeah. From some of the programs I'm working on too, we're also looking at, they're evidence-based programs, but what adaptations can we make to them so that they're more accepting, more culturally appropriate for the communities that we want to reach. And we've been working over the last 2 years on adapting evidence-based health promotion programs for tribal communities around falls prevention and chronic disease management in particular. So we're really excited about that and figuring out how to make these interventions more effective in communities all across the United States.
Mm-hmm. Thank you, Kathy. You brought up some really great points when you were talking about digital connectedness and that being a new social determinant of health. It draws me back to the work I've done around the Affordable Care Act in the past, and how, without health literacy, how can somebody actually know what is there for them, and how are they really seen without understanding what they're engaging with? And so digital literacy, as you say, is definitely a part of that conversation. So thank you for bringing that up. And I want to close with Orleen, just to hear a little bit from you. And we have talked many times about the twin pandemics, and we have talked about the fact, and I think somebody mentioned it on this conversation, the real necessity that especially communities of color may have to watch out for one another during this time, but how difficult it can be when we are alone but together, right? And so how do we kind of learn from communities in the local community setting and apply these concepts nationally? And kind of just some closing thoughts from you before we get some questions from our audience.
I think one thing that is, when we talk about resilience fatigue, is that communities of color, marginalized communities, have been resurrecting and renewing themselves for generations. It's not that this is new. It's not that it's something that a person of color doesn't come to understand. This is part of how I survive. Mm-hmm. This is part of how I live in the community that may not value me, who may not respect me, who may not acknowledge me on a human level. But I think in communities of color, there is a bond. There is a strength within the community through church, through community groups, through sororities, fraternities, through social and civic organizations that have sustained these communities from within for decades of issues that have come their way. And it's one of the things that within the community at this point that's different is that there has been a worldwide response to COVID-19. There has been a worldwide response to injustices, inequities, to the atrocities of George Floyd. That has galvanized a movement that I think has resonated with multi-generations, with folks that never knew each other existed. And you do see the marches and the movement and the continuing effort by these groups on lots of different levels within the community to start addressing the systemic issues such as education, having a true history of America presented so that everybody's educated, having a true balanced access to care. And with older adults, especially since the Juanita C Grant Foundation specializes in the 50 plus, having access to non-digital information on healthcare is pivotal. We find through our Village Connector Experience program now, because we're in rural as well as urban areas, that there are areas where individuals do not have a computer. They have no Wi-Fi. The phone they have is rudimentary. And so in order to even register for the program, they have to call to be registered. And we're doing work with internship group, Marymount University nursing students on a public health research project with us, looking at COVID-19 and how to galvanize the community. Issues they picked up were Wi-Fi divide, transportation divide, where the river separates different communities, and one community has access to care and one doesn't. So the mapping within each community by the Department of Health, the Planning Department, civic, political leaders, educators, religious leaders must come together and utilize all those resources, and having the approach be tailored to that particular community and the nuances of that community, especially older adults who may be disabled, may not be able to navigate a bus or Uber to get to the center to have a vaccine, even around the corner to visit their pharmacist, which is the closest place they might be able to go to. So all those factors must be considered by the community. And the national organizations, I think I've been extremely happy to see the focus on communities of color and bringing those resources to the community. And also the philanthropic community has redirected their funds to organizations that work in communities of color, led by African Americans, Latinos, LGBTQ community. That funding has now been redirected to a more pointed approach versus a more global approach. And I think that's all very hopeful. So between all of those, having conversations like we're having today and having those go on in individual homes, in communities, at church, on Wi-Fi broadcasts, podcasts, I think it's a very hopeful sign that the communities will come together at a local, and the national will also help support and lead that in that direction.
Thank you so much, Orlene. That was very poignant to address just a variety of issues. Like you said, there were so many individuals that have been talking about, have been discussing, have been calling each other, have been engaging in social media, have been marching, whatever it is that they've done during this time. Like you said, maybe even for the first time in their lives together. And I think that's really hopeful for the future. And so I really appreciate your perspective. And again, too, is thinking about those partnerships that at the end of the day, strategic partnerships or coalition building or community organizing is all about relationships. And we know now more than ever that relationships are what matter most. And so before we open it up to a question or two, I do just want to remind people that, two ways that we can continue, whether it's through the conversation and education around the vaccine or talking about just COVID-19 or racial injustice is, you know, two ways for communities of color and everyone, frankly, to be seen and to be heard are: one, to make sure that you've filled out the census. You still can, and I encourage people to continue to do that. And two, to vote. And we all know that our voice matters, and primarily the voice, at least who we're focused on today, and who we focus on at the National Council on Aging, are the voice of millions of older adults. And so in closing, you know, I think it's thinking about what you all have made me think about today is, what kind of country do we want to live in? You know, and I think that many of us that are tuned in today, that are working countless hours in nonprofits, in the health sector, in government, we know that every day we are living kind of that truth of what kind of country do we want to live in, and we devote ourselves to our work. And so I will open the panel to a question or two. Let's see if we have any questions. I know there was a question about community health workers. We talked about how they would play a pivotal role and definitely should be included in the conversation of education and awareness building around the vaccine. And also just thinking about some of the recommendations, and you know, maybe this is someone asked about sending out some of the recommendations or best practices that I think we've created on the spot here, that we could put together and maybe create a resource for people to start to talk about these things, you know, among their groups, organizations, their churches, their centers of faith. You can contact your local health department. You can ask them if there's a planning process to prepare for the COVID-19 vaccine. Check Centers of Disease Control website for regular updates. Stay engaged with local pharmacists, primary care providers. There's a number of things that you can do. Seek valid information from multiple reliable sources, from experts. We love science. And so, you know, it's thinking about a variety of different things that likely all of you are already doing. But there is always a chance to get more involved. Also, we have a list of resources that we have linked on our website, and also have been linked on the Juanita C. Grant Foundation's website, www, and correct me if I'm wrong, Orleen, but www.jcgfdn.org. And you can find resources around COVID-19. At the National Council on Aging, we have resources in both Spanish and English. And then also the community resources that are available, cms.gov, our friends at the Administration for Community Living, and Greater Office of Minority Health, so Greater HHS resources. But again, I just thank everyone. I thank our panelists. Truthfully, this conversation could not have come at a better time. It was empathetic, it was empowering, it was real, and it was honest. And I thank you so much. I thank you, Orleen, and the Juanita C. Grant Foundation for your partnership. And these resources will be shared with participants as well. And again, you can go to our website at ncoa.org for a link to these resources, or you can go to the Juanita C. Grant Foundation for a link to these resources as well. So we thank you so much for joining us. We hope you keep your eyes open for more conversations like this one. Be well, be safe, and thank you so much.